Hello and welcome. Today we are diving deep into one of the most incredible transformations in all of human biology, pregnancy. And I want you to forget everything you think you know. We're going way beyond the bump to uncover the truly mind-blowing architectural and physiological remodel your body goes through. Okay, let's get into it.
So what is really going on in there? Because it's not just about, making a little extra room for a baby. It is a total system overhaul, from your skeleton all the way to your circulatory system. Honestly, the scale of this transformation is something you just have to see to believe.
Let's just start with this number, 4,000. That represents the potential increase in your uterus's capacity. It goes from being about the size of a small pear to an organ that can hold a full-term baby, increasing its weight by 20 times. I mean, think about that. It's an expansion on an almost unbelievable scale. And to support all this new life, your body basically upgrades its own internal life support system. Your total blood volume shoots up by a staggering 35 to 50%. We're talking an extra 1.5 to 2 liters of blood. This creates a kind of supercharged delivery system, making sure a constant flow of oxygen and nutrients gets across the placenta to the baby.
So that brings us to our first section, which we're calling the Great Architectural Shift. This is all about how your body fundamentally rebuilds its own foundation to handle the massive changes we're starting to see.
As the uterus and breasts get larger, your center of gravity literally shifts up and forward. Now, to keep you from just toppling over, your body makes these brilliant little adjustments. The curve in your lower back gets more pronounced, your shoulders might round forward a bit, and you might even find yourself walking with a wider stance. It's this constant, subconscious effort just to maintain balance.
Okay, to really understand this whole shift, we need to meet the two main characters in our story. First up, the pelvic floor. The best way to think of it is as a muscular hammock or a sling right at the base of your pelvis. This structure is really the unsung hero of your core, providing all that crucial support from below.
And its job description is, well, it's incredibly complex. It holds up all your pelvic organs, it withstands the pressure when you cough or sneeze, it helps stabilize your spine, it keeps you continent, and it plays a huge role in sexual function. This is a seriously important group of muscles.
So who's our second main character? Your abdominal muscles. As your baby grows, these muscles are stretched to their absolute elastic limit. And this incredible stretching, well, it dramatically reduces their ability to contract the way they're used to, which creates a major challenge for your core's overall stability.
This leads us right into our next section, the core under pressure. Now we're going to look at what happens when these two key players, the abs and the pelvic floor, face their biggest tests during the final stages of pregnancy and, of course, childbirth.
One really common result of all that intense abdominal stretching is a condition called diastasis recti. It's basically a separation of those outermost six-pack muscles, the rectus abdominis, right down the middle at the linea alba. That's the connective tissue that joins them together.
And just how common is this? Well, this number is pretty eye-opening. Up to 66%, that's 2/3 of women experience a significant separation in their third trimester. It is a completely normal physiological response to the incredible biomechanical forces of pregnancy.
Meanwhile, that pelvic floor hammock we were talking about is under immense strain. I mean, just from the weight of the pregnancy alone, it can drop by as much as an inch. Then, during childbirth, it goes through this extreme stretching, which can sometimes compress the nerves that supply it. And that can potentially lead to issues like incontinence or prolapse later on.
Okay, so that was a lot about the challenges, but the really empowering part of this whole story is understanding how to recover. So let's move on to our next section, your recovery blueprint, and look at some safe and really effective strategies.
First things first, let's talk about that diastasis recti. You can actually do a simple self-test just by following these steps. You lie on your back, gently lift your head, and you can feel for that separation at your midline. If you find a gap that's wider than about 2 fingers, that's something you'll want to address with specific exercises before you jump back into, say, crunches or other intense ab work.
Next up, reconnecting with your pelvic floor is absolutely key. And look, this doesn't have to be complicated. These 3 foundational exercises are incredibly effective. A simple contract and relax, some quick little contractions to handle sudden pressure, and the elevator exercise to really improve your fine motor control.
Now here is a point that is so often missed. The ability to relax your pelvic floor is just as important as the ability to contract it. True control means being able to fully release that tension. It's crucial for childbirth, and it's also crucial for preventing pain or something called hypertonus, which is when those muscles are just chronically too tense. And of course, safety is always, always, always priority number one. These are the absolute red flags to watch for during exercise. If you experience any of these symptoms, you stop immediately and you contact your doctor. It's all about listening to your body and respecting its limits during this really unique time.
So how do you know how hard to push yourself? For a long time, people focused on target heart rates, but the research now shows that's just not the best approach during pregnancy. Instead, listening to your own body's signals, using a scale of perceived exertion is much more effective.
And this is the Borg scale. The sweet spot for most uncomplicated pregnancies is right here, in that 12 to 14 range, what feels moderately hard. The best gut check? You should feel like you're working, but you should still be able to comfortably hold a conversation. If you can do that, you're in a great spot. And all of this brings us to our final and maybe most important section, a foundation for life. Because what you learn about your body during pregnancy isn't just for a 9-month period. The lessons of pregnancy truly don't end at delivery. This whole experience gives you an unparalleled opportunity to understand your body on a much deeper level, to learn about your true core, your posture, and the incredible dynamic system that supports you every single day. This is knowledge for life.
So I'll leave you with this question to think about. Whether you've been pregnant or not, understanding these principles is so powerful. So how can you use this new body awareness to listen, to support, and build a stronger foundation for your own life? Thanks so much for joining us.